And welcome back. You know, in 2010, the U.S. Drug Enforcement Agency created a National Prescription Drug Takeback Day as a way to encourage people to safely and properly dispose of unwanted medications. Now, last year, over 792 tons of medications and medical supplies were collected and disposed of by law enforcement agencies across the nation on these drug take-back days. Now, the next one takes place this Saturday, October 29th, and Corewell Health, formerly Spectrum Health, along with several community partners, are taking part. Here to talk via Zoom about this is Dr. Colleen Lane. Good morning, Dr. Lane.
Good morning. Thank you so much for having me.
It's our pleasure. Please tell us about National Prescription Drug Take-Back Day. Can you speak to its efficacy or the effect that it's having?
Yeah, so it's a really important national day where health partners, as well as other community partners, work with our law enforcement colleagues to give people an option where they can safely and anonymously bring extra medication to us so that we can dispose of it without any effects on the environment.
Now, this is from what I understand, a community-wide effort. Everyone around in West Michigan taking part in this. So exactly how does it work? I mean, I know that in my bathroom drawer, I'm sure I have some expired prescriptions.
Yeah, so we know that, folks might have antibiotics laying around, even medication from their pets. And really importantly, we know from some of the research that we've done that about half of prescription pain medications end up in the hands of people that it wasn't intended for. So this is a really important day where you can look through your medicine cabinet, maybe your parents' medicine cabinet, and go through and find any prescription medications that you no longer need, and you can bring them to experts who can have an environmentally friendly way to dispose of them and make sure that those medications don't end up with somebody who doesn't need them.
I think, yeah, you just repeat that number again, why people should realize how important it is to get these medications gone and disposed of properly out of their homes. You said that nearly half ends up in the wrong hands?
Yeah, so we know about 50% of prescription opiates end up with people that it wasn't prescribed for. So we know that this is important, especially for young folks who may come across a prescription medication and be curious and may decide to experiment with it. So by keeping your medication cabinets cleared out, you're helping protect your family, friends, and your community.
And of course, this is not something that you should ever just flush down the toilet or put down the sink. These are things that you want to make sure don't end up in a water supply. You want to dispose of them properly. More than just dropping off these medications and drugs, though, other events happening around this event?
Yeah, so we're going to have experts in the medical field that can talk with people about Narcan, so the medication that reverses an opioid overdose. We're going to have law enforcement partners. We're going to have lots of experts on hand, so if people have questions, they can safely and anonymously discuss those with a professional.
Dr. Lane, we thank you for your time this morning and for the important information. Thank you so much for joining us.
Thank you very much. Have a good rest of your day.
You as well. Corewell Health, the medical group, just one of the many partners around taking part in National Drug Take-Back Day. So, Saturday, October 29th, that's the time from 10 in the morning until 2 in the afternoon. It is free, it is anonymous, it's a public service for the disposal of those expired or unwanted medications. Please make sure you go through your bathroom and go through your drawers, see if you have any of those expired drugs and dispose of them properly as well. We'll be right back.